Chronic kidney disease, or CKD, is when the kidneys slowly lose their ability to function over a long period, usually years. It means the kidneys cannot filter waste and extra fluid from the blood as well as they should. The most common causes are diabetes, high blood pressure, and other conditions like kidney infections, autoimmune diseases, or family history of kidney problems. In the early stages, there may be no obvious symptoms. As the disease progresses, you might experience fatigue, swelling in the legs or face, trouble breathing, high blood pressure, and dark, foamy, or blood-tinged urine. There is no cure, but managing the underlying conditions can slow kidney damage. In severe cases, dialysis or a kidney transplant might be needed. Acute kidney injury, or AKI, is a sudden and rapid loss of kidney function, usually occurring within a few hours or days. The kidneys fail to filter waste and extra fluid from the blood properly. Causes include dehydration, severe infections, obstructions, and medication side effects. Symptoms include decreased urine output, swelling in legs, ankles, or feet, nausea or vomiting, and confusion or drowsiness. AKI can often be reversed with prompt treatment, which may include fluid replacement, stopping harmful medications, and dialysis if kidney function does not recover quickly. Kidney stones are hard deposits of minerals and salts that form in the kidneys. They can be very painful if they get stuck in the urinary tract. Causes include dehydration, diet high in salt or animal protein, and medical conditions like gout, certain infections, or obesity. Symptoms include severe pain in the back, side or lower abdomen, painful urination, blood in the urine, and nausea and vomiting. Treatment includes hydration, pain management, and surgical removal for larger stones that can't pass naturally. Polycystic kidney disease, or PKD, is a genetic disorder where fluid-filled cysts grow in the kidneys, causing them to become enlarged over time. These cysts can interfere with kidney function. It is inherited, meaning it runs in families. There are two types: autosomal dominant PKD, the most common form usually affecting adults, and autosomal recessive PKD, a rarer, more severe form often seen in children. Symptoms include high blood pressure, pain in the back or sides, blood in the urine, and urinary tract infections. There is no cure, but treatments aim to manage symptoms, including controlling blood pressure, pain management, and, in severe cases, kidney dialysis or transplant. Glomerulonephritis is inflammation of the glomeruli, the tiny filters in the kidneys that help remove waste from the blood. It can be acute or chronic. Causes include infections like strep throat, autoimmune diseases like lupus, autoimmune diseases like Goodpasture syndrome, and viral infections like HIV or hepatitis. Symptoms include swelling, especially around the eyes, face, and legs, high blood pressure, foamy or bloody urine, and decreased urine output. Treatment depends on the cause but may involve medications to reduce inflammation or control immune response, blood pressure control, and, in severe cases, dialysis. A urinary tract infection, or UTI, is an infection in any part of the urinary system, including the kidneys, bladder, or urethra. If the infection reaches the kidneys, it's called pyelonephritis. Causes include bacteria, usually from the bowel, entering the urinary system. Women are more prone to UTIs due to shorter urethras. Symptoms include painful or burning urination, frequent urge to urinate, cloudy, strong-smelling urine, and back or side pain if the infection reaches the kidneys. Treatment includes antibiotics to treat the infection, pain relievers, and increased fluid intake. Kidney cancer starts in the cells of the kidneys. It is often called renal cell carcinoma. The exact cause is unclear, but smoking, obesity, and genetic factors can increase the risk. Symptoms include blood in the urine, pain in the back or side, unexplained weight loss, and fatigue. Treatment includes surgery to remove the tumor or even the entire kidney, chemotherapy or radiation therapy in cases where surgery isn't enough, and targeted therapy with medications that focus on cancer cells. Nephrotic syndrome is a group of symptoms that occur when the kidneys leak too much protein into the urine. This can be a result of kidney disease or other conditions. Causes include conditions like glomerulonephritis, diabetes, or lupus. Symptoms include swelling, especially around the eyes, legs and feet, foamy urine, high cholesterol and fatigue. Treatment includes medications to control swelling, lower cholesterol and reduce protein loss, as well as treating the underlying disease causing nephrotic syndrome. Diabetic nephropathy is a type of kidney damage that occurs in people with long-term diabetes. High blood sugar levels damage the kidneys over time. Causes include uncontrolled high blood sugar from diabetes, which harms the tiny blood vessels in the kidneys, making it harder for them to filter waste. Early stages often show no symptoms. Symptoms include swelling, especially in the legs and feet, high blood pressure and fatigue. Treatment includes strict blood sugar control, medications to control blood pressure and reduce protein in the urine, and dialysis in advanced stages. Hypertensive nephropathy is kidney damage caused by long-term high blood pressure. Over time, high blood pressure damages the blood vessels in the kidneys, reducing their ability to filter waste. Causes include chronic uncontrolled high blood pressure. Symptoms include swelling, especially in the legs and feet, fatigue, and changes in urine. Treatment includes blood pressure medications and lifestyle changes like diet and exercise. To maintain kidney health, stay hydrated by drinking enough water, control blood pressure and blood sugar. Avoid smoking. Eat a healthy diet and have regular checkups, especially if you have diabetes, high blood pressure, or a family history of kidney disease.